Good afternoon, everybody. This is Steve Wilson. I'm with the Illinois State Water Survey and manage the private well class. And today, the webinar you're attending is entitled "The Water Testing Labs Need to Know About Private Wells." We have a group of folks who are going to present today, and this is being done in conjunction or co-hosted by the Association of Public Health Labs. And this program, at least the private well class program that we run here at the U of I, is through the Rural Community Assistance Partnership, which is a nonprofit that serves small communities and private well owners around the country, and all that funding comes from US EPA. So I just mentioned RCAP, and it's co-hosted by APHL, and so we are recording this webinar, and if probably in a week it'll be on the private well class's webpage or webinar page. It may be at some other locations as well, depending on if APHL wants to put it up on their site or whatever. So it's all based on the private well class, and I want to mention that Katie Hollenbeck from the Water Resources Center is taking questions that you might have during the webinar today. So there's a tab on the questions bar for the GoToWebinar screen where you can do that, and also Jennifer Wilson is from the Water Resources Center is kind of handling all the logistics and made everything come together for all of us to get together and do this today. So quickly, on your GoToWebinar screen, the questions tab maybe have a plus sign. That means it's minimized. If you click on that plus sign, it'll show this, what I've got up here, where you've got a blank screen to ask questions. It says you can send privately or send to all. Just send it privately. It doesn't matter either way, but Katie will be monitoring those and making a list of all the questions that get asked today. And from that, assuming there'll be some time, we'll answer all those questions at the end. So with that, I want to introduce Sarah Wright, who's with the Association of Public Health Labs. She's our first speaker today. And I guess with that, Sarah, I'll let you go ahead.
Thanks, Steve. Hopefully everybody can hear me out there. We really appreciate this opportunity to co-host this webinar with the private well class. You all have been a great partner so far. And I would like to give you a little bit of background on APHL and why we're doing this webinar in particular. So at APHL, we work to strengthen laboratory systems serving the public's health in the U.S. and globally. We represent state and local governmental health laboratories, including environmental laboratories that conduct testing on water, air, and soil. In a 2015 survey to our members, we found out that at least 32 of 50 state public health laboratories in the U.S. provide some sort of testing services for drinking water systems not covered by the Federal Safe Drinking Water Act. This includes private wells. Over 40 million people, approximately 15% of the U.S. population, rely on these private wells for drinking water. Since the Environmental Protection Agency does not have authority to regulate private well water, it is up to state and local governments to determine if and what rules will be set to help protect well users. It then falls upon state, local, and private laboratories, you all, to provide these testing services for individuals and communities using unregulated water. So the state, local, and private laboratories play a critical role in answering the questions, what's in my water and is it safe to drink, to these 40 million people. You might be the first laboratory that they've ever brought a sample to, and the experience that they have might determine whether they continue to test their water. Your background knowledge of well water users based upon your experiences, information learned from this webinar, and additional research may provide that extra bit of customer service that builds that relationship. A future laboratory test may then tell that customer 5 years from now that a nearby septic system is leaking into their well's groundwater source and likely contaminating their drinking water. Using this data, they may confer with their local health department to determine that the pollutant source is there and what it is, and or initiate a treatment that can keep their family safe. As you're well aware, every day your laboratory testing provides the data upon which public health decisions are made. And your background knowledge of well water may help you better connect with your constituents, serve your constituents, and ultimately better protect public health. We have what we think will be a very informative webinar geared towards this target laboratory audience. Steve mentioned he will be the main instructor today, but you'll also hear from Paul Suska from the New Hampshire Department of Environmental Services, Dan Webb of the Illinois State Water Survey, and Peter DePippo of the Rhode Island Department of Health. These three will share their insight on specific well water testing services and partnership and outreach programs that have been successful in reaching more constituents more consistently. I'm looking forward to learning more myself today about this important topic, and with that, I'll hand it back to Steve.
Thanks, Sarah. And so moving on today, what I'm really going to talk about is the well owner side of things. I'm a groundwater hydrologist. I work with well owners in Illinois and throughout the country. And so we get a lot of questions about, well, even questions, well, my lab said I need to know what to sample for. They're not going to tell me, and, lots of variations on that theme. And so today I'm going to really talk about well owners, their demographics, really understanding where they're coming from and the issues that are important to them, as well as labs. And what I see, or we see, is the laboratory's role in helping well owners understand the issues they might have. They're just, a lot of cases, very uninformed individuals as far as understanding the risks that might be there. And we think labs can play a big role, as Sarah just mentioned, in making them feel comfortable or understanding why they need to sample and whether they're going to come back and do it again or not, because it's something they need to do regularly. And then after my portion will be the other three gentlemen speaking about their example programs and the partnerships they've developed. And then at the very end, a number of you have asked questions that you provided when you registered. We'll try to get through most of those and then take any questions you may have today. And again, you can use the question tab on your GoToWebinar screen to ask things that may come up during today's presentation. So well owners are a unique demographic because they really represent every demographic. They come from every social, economic, and education class. Landowners who've lived there in their entire life, their grandpa lived there, their great-grandpa lived on the same farm, maybe the same well, versus someone who's brand new to a private well. They've lived on city water their entire life, a public water supply. So you could be in a very rural area, which was where I grew up, on a dug well, or in a very urban setting like Cook County. For those familiar with Cook County, Illinois, that's Chicago proper, and the innermost county of the 11 counties that surround the Chicago Metroplex area. So when you look at that, people think, well, there's no private wells in Cook County or in that area. There definitely are. Every municipal boundary that has some variation, and there's these unincorporated areas, there are private wells and subdivisions. So the folks that live in this area, Cook County, you can see on the screen on the left, as you move over towards further left on that screen where it says DuPage, Lombard, Oak Brook, Hillsdale, that's the blow-up that's on the right side. And you can see there's a well that was drilled in 1995, which is well after all this has been developed. There are 3,000 private wells in Cook County alone, and most people are really surprised by that. And so their issues are urban and contamination and road salt and industrial contamination and some of those things, versus where I grew up, that little building at the bottom of that picture, there's a 14-foot deep, 3-foot diameter dug well that was hand dug by my grandpa in 1933. If you look at the bottom map, I grew up near Middletown, Illinois. It's a town of 350, and that little blue circle is where that well is. There are 2 other wells in the entire square mile. So a much different situation. You can see the creek that was a half a mile behind our house was flooded when this picture was taken back in the 70s. Our issues were, if we ran out of power, we had an ice storm, we were without power for 7 days. Well, you can't run a pump without power. And the location and depth of this well is such that every time there was a heavy rainstorm, our water was muddy. And so was it protective? Not at all. And we're very lucky that we didn't have a lot more health issues because of our well. This is a pasture with livestock in it and all those things. So different people have different issues. And, my dad swore our groundwater was always better than city water because it didn't have chemicals in it, not understanding that those chemicals are there to protect us. So the other part of this is attitude and well owner perceptions of things. Barb Lukonen from the University of Minnesota Extension, she's now retired, did this study about 10 years ago where they sent out 2,700 questionnaires to well owners in 6 counties, 3 in Minnesota, 3 in Wisconsin, and 3 in Michigan. They got 1,733 responses back, and they gave them a laundry list, if you look at the list on the right, of reasons why they haven't tested. So of the 1,733 respondents, over 1,100 had not tested their well ever. And they could mark as many of these things that they want, And half of those people said that they've been drinking it for years, and that's a reason not to sample and why they didn't have any concerns. On the bottom left, 87% were only slightly worried or not worried at all about their drinking water. And so what we've learned from things like this, and this is probably one of the best studies of its kind to look at well owner attitudes, is either they don't know what to test for or how to test or why they should test. That's one of the big reasons. And the other is their perception that it's safe and it's not a risk. This bottom number 10, I don't want to know. So 8% of 1,100 people said they don't want to know what's in their drinking water. And I equate that to why folks decide not to go to the dentist. They know it might hurt, they know it might cost them money, and they're okay, they can live with the way things are. And, that's just a human nature thing, but it's really a problem. In Illinois, when you sell a home, you're required to fill out a form that says, I know nothing adversely wrong with my well, my drinking water, my septic, all those sorts of things, and it's a binding document. So I've done a lot of research looking at water quality in Illinois. We were doing an arsenic study, and I went to this gentleman's house and asked if I could sample his well. He said, only if you don't send me the results and you do it when I'm not home. And so when I asked him why, it was because he was trying to sell his home and he wanted to be able to write on that form that he knowingly didn't know anything adverse about his well. So there are a lot of reasons, a lot of issues. Some of them are disturbing, if you will, but they certainly are all valid, and because there are no laws that require well owners to test or to even drink water that's considered safe, they're really on their own, and it's their decision, and it's a very different dynamic than we have with our public water supplies. So obviously they're contacting you as a lab because of testing. There's a lot of different reasons. Just general concern, property transfers are a lot of things these days because banks, HUD, USDA all require sampling for home loans these days. Someone may have gotten sick. I would imagine a lot of these are media-induced. For instance, I wonder how many labs would raise their hands if I said, have you seen an increase in people wanting lead samples since Flint happened and it all became public? There's a lot of different reasons. So most of the time it ends up being you see a spike in sampling and well owner awareness when there's some sort of issue. A drought caused some issue or flooding, some kind of nearby contamination, obviously fracking and lead. And then also if you're on the fringes of a public water supply and they've had some kind of public notice because of contamination, then you might see an increase in sampling. And those are great as far as increasing the number of well owners who are taking care of their system. But most of the time, those aren't really the issues that affect the water quality for most well owners. They're really basic things that aren't being done. Poor well construction, abandoned wells, and just a lack of well owner knowledge and education on the risks they might have from their well. And I showed two examples here of old hand-dug wells. One has a brick missing, the one on the right, and the one on the left just had a wood cover. Neither one are protective. Snakes, rats, anything else can fall in those wells. We do a lot of sampling. This is one of my colleagues sampling a well. We did a dug and bored well study a number of years ago looking at atrazine and ag chemicals and pesticides in these wells that are in farming parts of Illinois. And it comes down to people believe these wells are safe, even though it's clear that there's no protection at the surface. And if you understood current well construction codes, these wells would not be considered, they don't meet the code, and they're not safe. So a lot of our education ends up being about these basic things. Similarly, on the septic side, many well owners tell us, how do I find my septic system? They don't even know where it's at, let alone if it's close to their well or if it's ever been pumped. And so there are these long-standing issues that have never been addressed, partly because local health departments or county health departments aren't required to make sure that these wells are safe in most jurisdictions, and also it's left to the well owner and they just don't understand. So as far as your client, the well owner as a client, as I mentioned, they may have no idea of what they need to test for or why. They just, for some reason, they may call you and decide they want a sample, or they may have an explicit list. We have certainly a number of well owners who are really kind of impressive in what they've learned on their own. They know exactly what they need to be concerned about, and they contact us, or they've taken our class. They're the ones you obviously would more enjoy working with because they don't need any guidance per se, but a majority do. And so you don't know what their issues are. As I mentioned, they may be selling a house and they only care about passing an inspection or the loan requirements. Could be a landlord and they really aren't interested in sampling, but their tenant has complained enough that something's funny with the water that they'll get it tested, but they're more interested in cost. And some just want some justification that it's safe. We've seen instances lately, one in particular here in Illinois, where the way the HUD rules are for selling a home, you're required to sample based on the local or state jurisdiction's rules. And if there aren't those rules, then you have to use the EPA guidelines for the primary drinking water contaminants. Well, one particular county only required nitrate and coliform sampling. So it passed. The well was considered, quote, safe, and the home was sold. And a couple years later, the homeowner had their well sampled, and they found out they have 150 ppb of arsenic. The well owner has contacted us a number of times. I know our lab, Dan Webb, who's going to speak later, has worked with this person. She wants the rules changed and the law changed, and she's mad because her well isn't safe. And so part of the problem we have nationally is there's an inconsistent approach as to what is safe and what needs to be sampled to ensure that your well is safe for your family. And that can vary from one place to another depending on what might be naturally occurring in the ground. So most are going to be relying on you to tell them what they should sample for. And what I tell well owners, and I want to throw this out early, I tell well owners that a good lab should be able to tell you what to sample for, explain why, and provide all the details for the process. How to collect the sample, provide the bottles, how soon they need to be delivered, all those things. And if they can't, I suggest they find a different lab. And the point is they need support, and we need to educate everyone on why it's important to sample because most just don't ever do it. And I do want to throw out, we're spoiled. I'm a groundwater hydrologist. I do a lot of research. Our public service lab, which Dan's going to talk about, kind of takes a research approach to sampling for well owners. And so we get really good data not only on the sample analysis, but in many cases more than one sample at different parts in the system, as well as the well logs we have here and understand the geology to actually go back to that well owner in the end and say, here's what we think's going on or why you have this issue, and here's what we recommend. And I know Dan's going to speak to that. I won't go anymore, but it really makes a difference on the level of trust well owners give us and the amount of questions we get from well owners who understand our expertise. And the more you know, the better service you'll be able to provide is the bottom line. So how can you help? Understand that most well owners will and need assistance, and that'll be in most cases, and they do want help. Sometimes they may act like they don't, or they may be short, maybe they're frustrated. They may have talked to 2 or 3 other people before they called the lab and not got the answers they wanted, but they do want help or they wouldn't have called you in the first place. So what you can do is if you can explain the basics to them, put them at ease. It depends on how big of a lab and how regional you are. But if you understand there are local vulnerable aquifers or what those are, what possible contamination sources there might be, issues with, is your well old? Does it, if your house is from pre-1930, for instance, you likely have lead pipes if they haven't been changed out. Just understanding some of those things and making sure the well construction, ask how old the well is again to give them an idea if it meets state standards, if there are standards in your state, all those sorts of issues. And it's basic information you can learn, and it will make you much better at providing services to these well owners. And also the other side of that is who to contact. I'm sure some of the labs have great relationships with their state or county folks, and knowing who those people are and being able to refer well owners to them, or your state geological survey or some of those sorts of organizations where, in Illinois you'd call us, the state water survey, to find out what naturally occurring contaminants there might be, as well as our state health department. But in every state it's different. It might be DEQ in one state or environmental resources in another. You just need to find those things out and develop a relationship. So, and then point them to resources. The last thing here, encourage them to learn more about their well and their issues. A lot of folks just don't care to know. They know their well works. They don't do anything about their well until they have a problem, and sometimes then it's too late, or they don't realize that their well may be vulnerable and it's been causing a problem for quite a while. So this is my opinion. I might have already said this, but as a groundwater hydrologist, and I've done a lot of sampling and also a lot of education with well owners, what I think you should be able to provide as a lab is guidance to a well owner on what to sample for. And that question was asked by a number of you on the call today. So in the questions at the end, I'm going to give you what we suggest and what we tell well owners through the private well class for our program. Then provide clear and easy instructions on how to collect and provide the sample to the lab. Give them local context so they can ask questions and feel more comfortable that are unbiased, like a county health department or local health department, your state health or extension, and other agencies, as I mentioned, that can provide well or aquifer water quality information, and those vary by state. And lastly, suggest where the well owner can go to get the results reviewed by a health professional. You know, that's one of the most critical things. One of the reasons people don't sample is they're like, well, if I sample and I find something wrong, then what? You know, they need to go to a qualified health professional who can help them understand what those risks are and possibly or hopefully help them with options to do something about it. So, you know, that's my part of things and what I feel a lab can do or provide. Again, we'll do questions at the end. So with that, I'm going to hand this off to Paul Suska from New Hampshire Department of Environmental Services. Yeah. Thank you.
All right. Thanks very much, Steve. So I am with the Drinking Water and Groundwater Bureau at the New Hampshire Department of Environmental Services. And so our main mission in my program really is regulating the public water systems. Kind of in our spare time, a few of us work on what we call the Private Well Initiative in New Hampshire. And so I'm going to give you a fairly quick overview of our Private Well Initiative with a focus on how we've worked with and continue to work with the public health laboratories, the state public health laboratories, and also working with the private labs to improve the effectiveness of the Private Well Initiative, and our goal there being to just increase testing, to try to get as many private well users as possible testing their water for all the appropriate parameters and then taking action to reduce their exposure to contaminants where indicated. In New Hampshire, as opposed to the 15% nationwide, I think Sarah mentioned at the beginning, 15% of the population nationwide uses private wells, but in New Hampshire it's about roughly half of the population. You can see in the pie chart on the right, that's from the New Hampshire Department of Health and Human Services, the Behavioral Risk Factor Surveillance System survey that was done in 2014. After you take out the 15% of respondents who rely primarily on bottled water for their drinking water source at home, it falls roughly into half the population using private wells and half on public water systems. So it's a huge public health issue in New Hampshire that so many people rely on these wells. The wells are not, there's no oversight in terms of water quality, and a significant percentage of those wells have naturally occurring contaminants that are at unhealthy levels. So you can see what I've circled here. Arsenic, about 20% of the private wells in New Hampshire have arsenic over the 10 ppb maximum contaminant level that applies to the public water systems. And then the picture is even worse when you look at radon, although I'll leave it to you to pick which which concentration of radon you want to use as a reference level. But I mean, if you look at the 300 picocuries per liter that EPA originally proposed, the estimate is 95% of the wells, and they're, because they're almost all bedrock wells in New Hampshire, are over that limit. And then the other thing that shows up often, as you can see near the top, is bacteria. Roughly 20% of the samples that come into the public health lab have some presence of bacteria. So our private well initiative has always been primarily an outreach and public information program rather than a regulatory program. Although there have been some exceptions. That is, there was a private well working group formed 2007 because of some study legislation, and that working group resulted in some actual legislation being filed which would have required testing of private wells when they were drilled, and also when a program was listed for sale, but that legislation failed. And so since then, again, we've gone back to focusing our efforts on outreach, and we've been working with a number of partners, probably the most important among them being the public health laboratories, which are in the Department of Health and Human Services in New Hampshire. Although the lab, which is in the same building as us, used to be part of our department, but now, again, it's part of the health department. We've worked quite a bit also with the Dartmouth Toxic Metals Superfund Research Program, which has focused a lot of their efforts on, at least a lot of their, well, they do a lot of research on arsenic toxicology, and so their research translation aspect of their program has put a lot of effort into working with us on outreach statewide regarding arsenic in groundwater. We've also been working with the child care licensing program in the health department with respect to the well testing requirements that apply to the child care facilities, the daycare programs that are not being served by public water systems or are not large enough to be regulated as public water systems. And finally, short story behind the potable water definition, the plumbing code, the International Plumbing Code says that if you're going to connect a water supply to a domestic water supply system, it needs to be potable water. There's no very clear definition of what potable means, and it refers back to the regulations of the local health authority having jurisdiction. And so what we have done, partnering with the Building Officials Association in New Hampshire, the Health Officers Association, and the Planners Association, is to develop a guide suggesting that municipalities modify or clarify what potable water means, to define it in terms of compliance with a short list of parameters. In other words, rather than saying you need to go to the entire Safe Drinking Water Act list, as Steve mentioned, what we recommend is potable for private wells be defined in terms of a shorter list of parameters, that particularly those that have some significant percentage of being at or above the MCL in New Hampshire. So our approach, I would say, to the entire private well initiative is informed by this social marketing concept, where part of the social marketing concept is understanding what are the barriers to the behavior that we're trying to promote, identifying those barriers and then trying to address those barriers. And if you look at some of the most important barriers on the left, and this is based on some surveys that we've actually done in New Hampshire, you see a lot of overlap with what Steve mentioned, that survey that was done by Barbara Lukonen. Lack of awareness, inconvenience are really important. A really key thing is what to do with the results. And we approached the New Hampshire Pediatric Society a number of years ago to see if there was a possibility that we could get pediatricians to have conversations with their patients about private well use, especially in light of the fact that the National Academy of Pediatrics has a policy position on that since 2009. But what they said is, as clinicians, we don't order a test unless we know what to do with the results. And so therefore, it's a little difficult for us to recommend that our patients get the water tested because we don't know what to do with the results of those tests. And so that we really took that to heart, and we developed a tool to help private well users interpret their test results, which I'll talk about a little bit later. So in terms of addressing these three big barriers, we try to get at the lack of awareness through mailings to all of the owners of wells that are drilled. When a well is drilled, the driller files a well completion report with us, and so we use that to send out a mailing. We send out press releases at every opportunity, such as National Drinking Water Week, National Groundwater Week, when a study is released that is relevant to private wells, working through our partners. And we've been promoting community well testing events. We recently had a project that was funded by the CDC for a couple of years, and it involved trying to identify what are the interventions, to use a public health term, what are the interventions that are most effective at increasing the desirable behavior of getting your well tested. And it turns out that of the various methods that were tested in our project, having these community well testing events seemed to be the most effective. And so one of the tools that was developed through that project is a toolkit, so-called toolkit for community officials to use to put together a community well testing event. And then finally, our Be Well Informed Treatment Guide, which I mentioned just a minute ago, and that's to help private well users overcome that barrier of what do I do with my testing results. And so with that as background, here are some of the key aspects of our relationships with both the public health lab and the private labs. So as I mentioned already, the public health lab used to be actually part of our department, and it's in the same building with us. And we've worked very closely with them over the years. We developed our testing recommendations, that is our list of parameters that we recommend. We developed it with the PHL, and they've incorporated that into what their standard package is. We work with them on what is their messaging around, so that our messaging is consistent with theirs in terms of well testing recommendations. We do speaking engagements jointly with them, and we also work with them in terms of supporting community testing events. And they provide the lab services for a lot of those testing events. And we're able to look to the public health lab to get data on test results. But I should point out that it's aggregated because they take very seriously the issue of customer confidentiality. So they don't give us any specifically identifiable data on well quality. They just aggregate it on a municipal level and give us those numbers. And we sit on their advisory groups, and they sit on our advisory groups. In terms of dealing with the private health labs, the private labs, it turns out that both the Private Well Initiative and the Environmental Laboratory Accreditation Program in New Hampshire are both located in my program in the Drinking Water and Groundwater Bureau. And so that means that we've got access to the private labs through them. We have a working relationship with them. And we often turn to the Environmental Lab Accreditation Program and to the Laboratory Association of New Hampshire to communicate with the labs, the private labs. And then we also direct private well users to accredited labs that are performing the tests that we recommend. We've developed a list of about 14, I think, accredited labs in New Hampshire and some nearby states that do all of the tests that we recommend. And then finally, the private labs in the reports that they provide to their customers provide links to our guidance and to our tools. At least some of them do, and we're trying to get the rest of the labs to do that as well. So we've made a number of sort of overtures to the private labs over the years to try to get them to support our goal of more testing and treatment. That image on the right is basically, that is a slide from a presentation that I gave to the Lab Association, trying to show what a huge untapped market private well users are. In each set of bars there, the blue, the sort of maroon, and then the yellow bars, those represent testing that's done by public water systems under the Safe Drinking Water Act. And then the bar, the sort of light green bar, represents the potential number of tests that could be done if we could get all private well users to test their wells once every 10 years. So the idea is just to show to the private labs what a huge market it is if we could all just get private well users to test more often. And as I mentioned, we ask the private labs to reference our materials, especially when we update them. We just recently updated our radon guidance. The second item, asking for voluntary reporting of testing volumes. Under the CDC project, we thought that it would be great to be able to measure the impact of the various interventions, the various things that we were trying out to try to increase testing. How do we measure the impact in terms of increasing testing? Well, we can measure that by seeing how many more samples come into the public health lab, but what about the private labs? We did manage to recruit a number of labs to provide us with how many tests they were doing on a weekly basis during that project. And I'll talk about that in a little bit. And so actually several labs participated in that, and what this graph is showing is it's showing, as you can see, the blue line, the number of analyses that were, the number of samples being done by the public health lab, and in red, the number of samples being done by the private labs that were participating in providing information to us. There's some similarity there, but an interesting thing you can see in this is the huge, relatively large spikes that you see when we had a community well testing event, and that just shows the potential for working with communities on increasing private well testing. And then the next slide smooths out those data by looking at 3 months, smooths out the data by showing the 3-month moving average, and you can see that the volume in the private labs and the volume in the public health lab track pretty closely if you smooth them out like this. So it was good to know that once we stopped with the reporting from the private labs, we could continue to use the public lab volume as an indicator of the total amount of testing that was taking place. And I did mention our Be Well Informed application, and basically it's a web-based application that enables well users to input the results that they get from the lab, and then they find out whether or not, of course, each parameter is within acceptable limits, but also what are the treatment options. And the unique thing about this tool is that you've probably seen other tools where it will tell you, for example, for arsenic, here's what your results mean, and here's what your testing options are. And then for iron and for manganese, it'll give you that same information. This is the only tool that we know of that takes all of your parameters into account simultaneously in showing you what your treatment options are. So if you want to check it out, just search for NHDES Be Well Informed. And we did consult with the private labs as we developed this tool, and they've been very supportive of this because I think, as I noted earlier, this sort of uncertainty about what to do with the lab testing results has been a barrier to testing, and the whole idea here is to remove that barrier. So we have more testing and treatment taking place. Now, frankly, there have been some issues, although I'm not sure, issues has kind of a negative connotation, but there have been some issues in working with both the public health lab and the private labs over time, and there has been some tension in the relationship with both. Although we're working on it. So I mentioned data sharing. Private labs are reluctant to share any data with us, even the volume data that I mentioned earlier. There are only a handful of labs that participated in that. And then the public health lab, as I mentioned, they're quite forthcoming about sharing data, but it needs to be aggregated in order to protect the confidentiality of the individual customers. In terms of our relationship, our program, we want to encourage testing at any lab. We encourage folks to use the state lab, to use the private labs. The state labs feel like, often the state lab feels like we're being too favorable with the with the private labs, and the private labs feel we're being too favorable with the state lab. So, and then pricing is an issue. The private labs have obviously total freedom in how they set their prices, where actually the state lab is constrained by legislation. If they want to change a package or change a price, they need to get legislation passed. A recent issue has been reporting limits by the private labs. We saw a report for a particular private well owner, and it showed the arsenic result being less than 10 ppb. So that meant the reporting limit was 10. We feel that that's much too high a reporting limit to have for arsenic, and so even though it's an accredited, even though that private lab was an accredited lab and they were using accredited methods when they were doing public water system samples, they're not required to use those same methods for private well samples. It was interesting for us to discover that issue, and we've been working that out. So the next slide, which is also the last slide, to summarize, we have a shared interest among the Private Well Initiative, Public Health Lab, and the private labs to increase private well testing by addressing the barriers that we've identified. We've got a great relationship with the Public Health Lab in terms of data sharing, and we continue to work with them on planning the direction that we're taking in the Private Well Initiative, doing outreach with them, and supporting testing events with them. And as we go ahead, we're hoping that as far as working with the communities on private well testing events, we're hoping that we can keep that going on a sustained basis. That's going to be a large emphasis of ours moving forward. Rather than simply responding ad hoc to these events, we want to really try to keep them going on a regular basis. And we also want to increase engagement among the private labs in these private well testing events so that just more wells get tested and more water gets treated. And so that's all I have. Thank you.
Thanks, Paul. Next we have Dan Webb from the Illinois State Water Survey's Public Service Lab, and I will turn it over to Dan.
Thank you, Steve. Thanks, Paul. Nice presentation. Like Steve mentioned, my name is Dan Webb, and I'm in charge of our public service program here at the Illinois State Water Survey. Steve and I are co-workers within our organization. I thought I'd first give a little history about the Illinois State Water Survey, and then I'll talk about the service we provide to citizens. It's for Illinois citizens. But we've been doing water testing since the foundation of the Water Survey back in the late 1800s. So for over 100 years, the lab has been in existence, and various forms of advice. You can see a sign here. This is sort of the basis for the foundation of the Water Survey. Initially, we started in the Department of Chemistry here at the University of Illinois, and there were a couple thousand samples tested back at the turn of the century, and to help track disease and so on. And we've continued doing some type of testing ever since. And I guess our main analysis is for citizens. The main analysis we do provide for citizens is a mineral analysis. We also offer lead testing, but the mineral analysis has traditionally been the focus of what we do. I'll give the parameters on the next page. We've moved around between different state departments. We've most recently been with the Department of Natural Resources, but now we've moved totally back into the University of Illinois as a division of the Prairie Research Institute. Before I get on to the lead analysis, I guess what I want to say more about the mineral analysis is that people will usually, hear about our service. They'll have some questions, similar to a lot of things that Steve mentioned before. They want to know what to test for. We usually try to discuss the situation with them first to find out if our test is applicable. Sometimes they'll want a test for bacteria or pesticides, things like that, and we refer them off to health departments or private labs. More recently, we've had a lot of calls, I'm sure everybody has, about lead analysis, and that's another thing that we have provided for people in Illinois. Our mineral analysis has been for people on private wells. It doesn't include municipal customers. We do get a lot of calls where people say, hey, I don't trust my city water supply. We refer those people off to consumer confidence reports or call the water supply and see if they can resolve their situation directly. But similar to other things that have been mentioned, private well customers don't have other resources to turn to, so that's the basis for our service. But the lead analysis is something that we do offer for all customers. To this date, we've analyzed more than 230,000 samples, and we store all the records here at the Water Survey. They're stored in a database out with our groundwater science section. We also have a lot of paper records. I know they scan things now, but these records go back. Steve could probably even touch more on it, but I know they go back, at least 70 years, and I don't know how far back they have records for, but it's a really nice resource we have here, the ability to work together. Our chemists in our public service lab will mostly be focused on the water quality, the testing, things like that, but we, on a routine basis, will go back and talk to our groundwater scientists about any type of thing, like if there are potential well problems, the customers might want to know well depth, area influences, water quality in the area, things like that. We can help talk to them about treatment, but I'll often seek advice from other scientists about those other questions, and it's just a really nice relationship we have with the groundwater folks. Often the groundwater people will think of things that I haven't thought of, so I do want to. It's really nice that they're available. I thought I'd list the things that we offer. We do approximately 35 things in our mineral analysis. It includes iron, potassium, calcium, magnesium, hardness, and sodium. Those are kind of the primary metals. We get a lot of calls about iron and hardness. We do also do primary anions, fluoride, chloride, bromide, nitrate, sulfate, and then a set of lower concentration metals. You can see them listed here: aluminum, arsenic, barium, beryllium, boron, chromium, cobalt, copper, lithium, manganese, molybdenum, nickel, silica, strontium, tin, titanium, vanadium, and zinc. Then there's a suite of miscellaneous analytes: pH, alkalinity, color, turbidity, phosphorus. We do a little bit of organic testing, not really anything specific. It's just a generic non-volatile organic carbon or non-purgeable organic carbon. Often people refer to that as tannins, or we make the relationship to tannins. And a lot of people have colored water, so we can advise on some treatment there. And lastly, we do total dissolved solids. Regarding our lead test, that is a separate request because we typically ask the customers to flush their bottles or flush their lines before they collect the samples. But the lead, we ask them to let the water sit in the lines for at least 8 hours, and then they'll send us a flushed and an unflushed bottle. I guess one thing to point out here is that we don't do any regulation. We don't set any health standards. So I usually refer people off to Illinois EPA or US EPA or public health guidelines. We follow up our results with a report of the results, a personalized letter. We ask them in some of their paperwork to express their concerns if they have any specific concerns, and we'll try to address those. And we also include an interpretation guide that shows EPA MCLs or other guidelines that our health departments will specify. Sometimes we get questions about speciation, like for arsenic. We don't do any speciation here. A couple of our big tests are arsenic, nitrate, and lead. But like I said, we don't do any speciation, so that can come up sometimes, but usually it's something we can discuss with the customer and resolve. Like I said, we don't set any regulations, and we forward them on to other guidelines if the questions become too difficult there. We do offer phone support before and after the analysis. Often people will just have generic questions that we can answer and they don't need a test. Sometimes, they'll have questions about their municipal supply. Like I said before, we'll just refer them to the city. Usually we'll go ahead and test the water. They have found out about us for a particular reason, so we'll test their water, and then afterwards, like I say, we'll send a letter, but often they'll call back and want a little bit more detail about some of the advice that we give them. We're always open to calls. Whether or not they did our test, we can answer questions about other labs' testing, at least as far as interpretation, not how the other labs do their testing. I guess that sort of ties into the last point I was going to make there, that sometimes people will ask us questions that aren't related. I don't know if I covered it before, but we don't do pesticides, bacteria, volatiles, radiological work, or specific organics. So a lot of times we'll refer people off to private labs or health departments is very common. We try to maintain a good relationship with health departments. We've got some partners in the Barrington area here near Chicago, and we like to kind of work together where we can, and it helps the customers in Illinois. So I guess that's my primary talk, Steve. Thank you.
All right, thanks, Dan. Yeah, and what Dan didn't mention, I don't think, is that until 2006, when Illinois' budget kind of went down the tubes, this was a state-funded program completely, and we were able to offer any well owner in Illinois free analysis for these samples. And so it's a shame that that's changed. We still do a lot of work for folks around the state, and it is really nice that we have, all the well logs for the state here as well, and we can bounce ideas off each other and all those things. So, all right, thanks, Dan.
Sure. I guess I could touch a bit, Steve, just maybe one more minute.
Go ahead.
Oh, okay. Just a couple of examples. I don't know if you call them case studies, but I'm sure you guys have all had similar things happen. But some of our more common questions, I touched earlier and said that arsenic and nitrate are a couple of our big things. I think Steve alluded to this arsenic customer earlier in the presentation, but yeah, we've had a couple high hits of arsenic, and when I say high, the regulatory level is 10 parts per billion, and a few years back we had something around 300, and so that was really surprising. That customer ended up switching to municipal supply and convinced their I guess the nearby municipality to extend the line out to them. and it led to a little research study. But more recently there was a woman who was pretty upset about finding 150 parts per billion of arsenic in her well. So it's if I compare the arsenic concerns to the nitrate and lead concerns, not that those other things aren't concerns, but lead in the samples that we've been getting, it hasn't been as big of an issue as you hear about in the news. And nitrate, generally, at least for a lot of the samples we get, it does appear high sometimes. And we've had one person that was around 90 parts per million. They had it tested by a private lab and health departments, and we worked for a couple months trying to help her resolve the problem. But I guess I was going to say that the arsenic seems like to me that it tends to be above the limit more than some of the other things. And that's it, Steve. Thanks.
All right, well, thanks. Yeah, and it really varies by state. So I know we did a survey of all the state drinking water agencies, and several came back and said, we don't have arsenic in our state. And Illinois does, not as bad as some, but we certainly do. So thank you, Dan. Next, we have Peter DePippo from Rhode Island. And
thank you, Steve, and Sarah, Paul, and Dan. Thank you for inviting me here. I'm Peter DePippo. I run the private well program at the Rhode Island Department of Health in the Center for Drinking Water Quality, and I'm here on behalf of Henry Leibovitz in the State Health Laboratory, and we'll be discussing how our private well program works with the University of Rhode Island and with the public laboratory to provide additional testing and coordinated testing. So the title of my talk is Private Well Program and Laboratory Coordination and How We Work Together to Protect Public Health. So in 2008, Rhode Island passed a law based upon some prior bad experience in the state with contamination. And the upshot of the law is basically that when new wells are dug or when property transfers, buyers must test their wells, and sellers must disclose all prior testing. And what you see there is a list of the required water tests for home sale. These tests have to be conducted by licensed professionals. The samples are drawn by licensed professionals. They need to be conducted at state-certified laboratories, and the results need to be interpreted by individuals who are licensed within the state. As you can see at the bottom of the slide, they're designed to particularly address concerns of sanitation and structural integrity, as well as to show how the well water will affect the value of the house over time, and to eliminate some of the known contaminants that we've found in our post-industrial state. So the state of Rhode Island is about 1,100,000 people. We have about 62,000 structures within the state that are serviced by private wells, and we're a post-industrial state. We like to think of ourselves as the birthplace of the Industrial Revolution, and as a result, we have many contaminated sites within the state. We have the glorious distinction of being where the first leaking underground storage tanks found to have MTBE were discovered in a rural part of the state, and as a result of that and some other contamination events, we've had the fortune or misfortune, depending on how you look at it, to have strong political support for aggressive testing regulations. So where do the labs fit into it? State-certified laboratories are required to be involved in all aspects of these tests to provide a legally defensible sample. And the results of the lab's analyses are relied upon by both buyers and sellers and banks to be able to negotiate for changes in conditions in the sale, to changes or approvals in the financing, and ultimately to recommendations for treatment if necessary, or if required, that would run with the house in perpetuity. So there you can see the way we present. Per our governor's orders, we present on our website state laboratories. We put our state, the ones that are located within Rhode Island or nearby Connecticut, which also has an office in Rhode Island, right up front on our website. And then there's another link there for the other majority of the labs that are located throughout the United States. That's a current link that will, if you're state certified to do testing in Rhode Island, we do provide a link to you, but our governor would prefer that people come to our local labs, so we plug it that way. And at the University of Rhode Island and at the Department of Health, we provide the ultimate backstop for arbitration when it comes to concerns about whether a result has been properly determined or not. So this is a consolidation of just imagine the wall of my office covered with Post-it notes, and this is the way it works. This is the way all the different elements in our program relate. And if there's one thing I could point out to you here, it's that the laboratories are dead center. We absolutely rely on the laboratories to provide quality data and rely on them as neutral arbiters of the results. They're not allowed to be affiliated with anybody who sells treatment, and we just want the numbers from them. We want quality, state-certified, reliable results from them, and then other elements rely entirely upon them when they make their judgments. So if I could just briefly review what this slide is. On the left in the big blue box is typically what we would see in a real estate closing. The elements in green are typically who's sitting at the table in a closing. You've got the property owner, the potential buyer, maybe a real estate agent who represents one or both of the sides, a lender, and usually a closing attorney or some closing agent. In the blue, in that same box, is the secondary lender, which is who receives that mortgage from the bank. So that would be Fannie Mae, Freddie Mac, FHA, and then beyond them is HUD that sets the minimum housing standards. And this entire system is driven by the reliance that HUD will not insure, or FHA or Freddie Mac or Fannie Mae will not buy a loan that's properly sourced by the bank. And in order to do that, it needs to meet the state regulatory requirements, which we have presented. Okay. Everybody in red here is a licensed entity. So the laboratory, the sampler, the home inspector, the interpreter, the well driller, those are all licensed entities. And so we have, when we first started this program, the first thing we did was we printed out a whole bunch of licenses. Why do we do that? Well, because the power in the license is to be able to take it away from them. So it gives them the opportunity to participate in this market, but if we find that they're going astray or that for whatever reason they no longer meet the requirements of being licensed, we can pull their ticket. And then around the periphery, you see the building officials who issue well permits in cooperation with our Department of Environmental Management and our Contractors Registration Board. They produce well logs with the well driller. On the right-hand side, in the orange, are all the elements that are coordinated at the Department of Health. And you can see how URI and Department of Environmental Management work in support of us. And then in the lower right-hand corner are the small or local public entities. Okay, so to make this happen, we have an aggressive outreach and education program with the University of Rhode Island. If you haven't been there yet, I recommend that you go to rhodeislandwelltesting.org, riwelltesting.org, where the University of Rhode Island, under a grant from the Rhode Island Department of Health, through our EPA Source Water Protection Funds, generated a list of plain language recommendations. We call them safe well water tip sheets that review all the major potential analytes and what their impacts are to the homeowner and what they might do to test the outline MCLs, what an MCL is, the necessary requirements for buying a home with a private well, and our annual testing recommendations. On the right-hand side of this, in the quick links, you'll see that there's information on our private well water workshops, which is a monthly outreach program, on a link to additional safe well water tip sheets, a well testing discount, because when we do these private well workshops, we recommend the use of, we want the water to be tested. It doesn't matter whether it's a state lab or a private lab. Many people would prefer to use a private laboratory, even though the state is there pushing our kits. We provide a well discount coupon for participating laboratories. It's a 15%, effectively what a private lab would pay somebody for a finder's fee. So we give them a 15%, we give the homeowners this 15% discount if they go to use a private laboratory as opposed to taking advantage of the state laboratory. And that eliminates some of the issues around competition. We just want the wells tested. In the lower right-hand corner there, you see we have a whole section there on information and resources for Rhode Island realtors, which refers to the state laws, the requirements, and some informative information about how you can use the test results to get remedies in the course of the closing, whether that's an inspection or remediation of the well, or water treatment or disinfection, or even the acknowledgement that if you find contamination above a certain level, you can, up until the end of your inspection period, withdraw from the closing. So one of the things that we recognize, and this is going back to Paul's point of what some of the limitations are, and I think Steve made the same point. So we have the private well programs, outreach events, which develop awareness, and recently we started facilitating sample returns, which addresses the issue of inconvenience. We recognize that cost is a factor, but more than that is convenience. So the costs, when the homeowner tallies the costs, they're thinking about their time, they're thinking about the inconvenience of getting it to a laboratory, and in a case I'll show you briefly, there are some places, even in our very small state, where it requires 4 hours of driving back and forth just to deliver a bacteria sample. So we do these community outreach events where we drop off sample kits at the end of the night, and we then make arrangements to pick them up in the morning en masse, coordinate with the laboratory for delivery, and here you can see the results of one of our events where we had 42 samples coming in. Each one of those samples is $100 worth of lab work. The small bottles are sterile specimenators for bacteria. The large are what we use for minerals, and those are our standard annual kits. So the homeowners pay for the samples. The lab assistants and the woman there is a graduate student at URI, coordinate all the paperwork, making sure that the checks have the right amount made out to the general treasurer of the state of Rhode Island, and they work alongside the lab assistant who's taking in the samples to double check all the samples on the way in, so that by the time they hit the laboratory, this is all taking place in the receiving dock, by the time they hit the laboratory, they're good to go, and quite frankly, the lab doesn't mind receiving the extra work or the extra bolus that's about to go through. They can do batch processing, and we really enjoy it. We get together and we play games with, okay, so we had 100 people at that well workshop. We think we're going to get 50 samples. Of those, how many are going to come in on the following day? And the people at the lab have an informal over-under lottery as far as how who's going to guess the right number of samples that are coming in. In the lower left-hand corner, you can see the vast number, or the variety of people who are involved in this process, from the frontline lab assistant to myself, to the directors of the laboratories, to even people in the financial services department. The chief pre-audit supervisor wanted to be involved because she wanted to be involved actually to figure out why people were having their wells tested, not so much the financial side, but when she understood why people were having their wells tested, she could then do some interesting projections. So we implemented facilitated testing. We work with local community partners, whether that's the local Audubon Society or the USDA field office. We do next day local sample drop. We do coordinated return. And then we do immediate out reporting of positive bacteria results. So in the that we had 35 people show up. We took 17 samples, and 2 were positive for E. coli. Normally about 30% of our samples are positive for total coliform, and about 2% are positive for E. coli. This was a very unusual result where we had 2 positive for E. coli. Of course, the first thing we're telling them to do is resample and see if we have a confirmation result. But when we get things like that, it shows us that we have value to the program. Okay, so this is a quick graph of how we were doing for sample returns prior to implementing the facilitated sample returns. And our goal was to get it above 60%. And we started facilitated sample returns in July of 2015, and that's about when it went vertical. And we now have additional numbers that extend into 2016, and we're operating above 60% consistently on our sample returns. Okay, so what do we do with this data? Well, all the data that comes into the Rhode Island Department of Health since 1988 is public data. It's public record. While that can be an inhibition for people to use us, we do get representative samples, and we like to use them where we can to identify areas of concern. So this is one area. You'll see there's a red, and this is on our private well information viewer. It's a product we put together here at the Department of Health to do an overlay. Within the red circle, that's a 500-foot radius. This is on Pine Hill Road in North Smithfield, Rhode Island. And in the lower right-hand corner, you can see the MTBE results for this area. We have a health action level in Rhode Island of 40 40 ppb, and you can see that there's some numbers there that are 160 and 340. So that was an area of concern that led us to investigate this area. It seems like a normal tree-lined residential road, but when you take a look at the aerial, you can see the large gravel operation in the northwest, which had an underground storage tank. And you can also see just to the east-northeast of the property, a automobile recycling facility, a junkyard, which had its own well on it, which was contaminated with MTBE. So MTBE is a product of 1970s era gasoline, and regardless of the primary responsible party here, it was clear that it was one of these two sources that needed to be investigated. As a result, we were able to do additional testing and notify and install treatment where appropriate. This is a little bit more common contaminant. I think everybody's got this somewhere. This is nitrate in Middletown, Rhode Island. So here this was a sort of a citizen science as a result of some very high levels. So you'll see the hot pink represents concentrations that approach 30 parts per million of nitrate as nitrogen. And you'll notice that those are down gradient from the two farm roads that go north and south approximately. And so this was in a case where surface water runoff was alleged to be driving nitrate into the poorly sealed wells along that horizontal road. And so we issued a press release as a result of this, and we're able to get 107 samples in this neighborhood and also samples outside of the neighborhood for comparison, and show a pretty strong correlation to distance from that field to these private wells. As a result of the public notice, I think many of you know that nitrate is responsible for blue baby syndrome. Directly across the field here, the first phone call I received at 8 o'clock in the morning following the press release was from an unlicensed, unregistered daycare facility with screaming babies in the background, and that was my get-out-of-jail-free card for raising a ruckus with the press. So as a result of that particular event, we conducted, we did a nitrate statewide model utilizing population density, distance from agriculture, and distance from both public wells which had nitrate above 5 milligrams per liter and from known private wells with nitrate levels above 5 milligrams per liter. We took those 4 overlays and generated a statewide risk map for nitrate contamination. And what's interesting about this map is it confirms that that we should have been looking in the neighborhood that was identified as a result of the private well testing to be high in nitrate, that was a miss, and that one of the reasons why we missed it is because it was the community furthest away from available private lab testing, actually furthest away from lab testing. So we hear about food deserts, and we talked about this as a laboratory desert. We then quickly used this to identify places where we could locate other private well workshops in the center of these orange areas. And interestingly enough, we went out in the middle of a snowstorm, and we had a packed basement of a public library with people who came in, had their wells tested. We didn't realize that that was a community that was still on private wells, quite frankly, and we got results that were indicative that we probably should have been there a long time ago. And I think that concludes my presentation. Thank you very much for your time, and I think that keeps us on schedule. Thank you.
Thanks, Peter. So this is Steve, and we're going to unmute all the speakers, and I'm going to start going through some of the questions that were asked in advance. I've put them up on slides. The first number of them I have answers that I've put up there. I'll read through quickly, and the way we're going to work this, I guess, is that if anyone, Sarah, Peter, Paul, or Dan have anything to add, or if some of these questions I didn't put answers to, and they're really more based like for a state person to answer, for instance, or a lab person, then we'll go about that way. And at the end, we've got a couple questions that people have asked during the webinar, but not many. So the first thing I want to mention is a number of folks have asked what they should be telling well owners to test for. And I know Peter showed what their list that the state of Rhode Island has for new wells and for transfer of property. And what I'm going to show you is actually very similar. But we had to come up with a list to tell well owners, we run this private well program, and it's nationwide, and well owners ask us this question all the time. And so what we try to tell people is really there's three things you need to do. One is you need to talk to your local or state health department and ask them for advice. If you have radon, for instance, like in New Hampshire, you call your county or your local health department, and they're going to say, yeah, you definitely need to sample for radon. Where it may not be, it was on the list for Rhode Island. It's not on our list, but it depends on local conditions. There's a lot of natural occurring contaminants. So one is to call someone locally who will be able to tell you if there are natural things to be worried about. The second is to be investigative, and that is look online. Peter just showed you a really cool GIS application. I'm going to show you a couple more real quick. Some states have information, or at least at a county scale, say we have arsenic in this county, or we have, uranium in this county. And so if you just look, it'll give you some idea of what those things are. And also, there's a stigma to private wells. So a lot of well owners don't want their neighbor to know that they have something, or they're worried that their neighbor will find out. But, you should be the opposite. We tell well owners they should call their driller, in their lab. You guys should know. That's the whole point here, I guess, if there's something locally that might be a problem. Or extension, for instance, a county extension office. One thing is, coliform bacteria. Peter mentioned nitrate causes blue baby syndrome, and that's true. It doesn't necessarily, there's not a lot of proof that it affects adults. I know there might be some in the literature out there, but it's very scattered. And so they're used as indicators to say, if your well's not properly sealed at the surface, you're very likely to have coliform or nitrate contamination in many areas of the country. So that's something that everyone should sample for annually, because if you do have a problem with one of those things, you likely have a source, and you likely have a well that may not be actually working the way it's supposed to and protecting from surface influences. But other than that, like I said, be investigative. This is a Massachusetts website. You can type in your address. It'll tell you whether you need to be concerned about arsenic or uranium. I use this in every presentation I give. This is from the Rhode Island Department of Health, from Peter's office. The little areas that are the little circles are old orchards, my understanding, where there might be arsenic problems, and this is like 5 years old, but the splotch that's in the middle, if you can see it, is where there's a beryllium concern in the state. And I'll be honest, I didn't know beryllium was a regulated contaminant, but it is. And so when he showed his list of things, beryllium wasn't on that, but it also said at the bottom there might be other things to sample for locally, and I'm assuming these health districts or counties would require that if you're in that area. And so that's the whole point, is if you just look online, you can find out a lot of information. I did, and I'm not that good at surfing the web, to be honest. So there's a lot of good information out there that'll help a well owner or help you understand what your well owners might be facing, and there are things you can tell them to do as well. But what we recommend, and this is based on, I've shared this with my boss, who's a chemist, and Dan and the Public Service Lab folks and our institutional water treatment folks, these are the things we recommend. Again, coliform and nitrate annually, and they're really an indicator that there's a problem with your well. The rest of these things are either naturally occurring or, copper if you have copper piping, zinc and cadmium if you have galvanized piping. All those things, one, give you an idea of your natural groundwater quality. You can look at the corrosivity of your water with these analytes, and then many things like arsenic or iron. We have a lot of naturally occurring arsenic and iron in Illinois, and the values do not change. Groundwater, if it's an aquifer and it's fairly deep, the water chemistry is fairly stable. So if you have iron, or let's say you have arsenic at 30 ppb in your well, 5 years later you sample your well, you should still have close to 30 ppb. It's either going to be 25 to 35 or 40. It's just not going to change a whole lot. And so one of the things, one of the advantages of measuring sulfate and pH and some of these things that aren't very sexy, if you will, is that they should remain the same. And so if something changes with your well, it'll show up in these analysis. If your TDS or your alkalinity change a lot or whatever, it's because something's changed. And so it gives the well owner a little peace of mind that, their well is still working the way it's supposed to. They're still testing for coliform and nitrate and bubble and those things. The next question, I'm just going to go through the questions, and you guys please speak up if you have anything to add, or if you want to speak up, please do. So are there MCLs for private wells? Well, technically, no. The MCLs are part of the Safe Drinking Water Act, which is the federal law that requires public water supplies to provide water that's safe, considered safe, and it meets all the MCLs, which are the primary drinking water contaminants. You know, as you heard today when Peter was talking, they do require sampling at sale of property, or in Rhode Island for new wells. New Jersey has a program for that. There's a couple other states. And so you're required to sample. Peter, what are the rules? Are there any rules for corrective treatment if there's a problem?
So the rule, basically, what the advantage is that it gives the buyer the opportunity to negotiate for treatment.
Right.
And to basically require the seller to install treatment, or to give them a credit that they could install their own treatment. The building official is the enforcing entity, and so unless they can show that the final result meets the standards, they can't get their certificate. They cannot get their certificate of occupancy, or the certificate of occupancy can be pulled, and as a result, the treatment has to be installed. And when it's installed, then that installation becomes part of what's necessary for that property to continue to maintain a certificate of occupancy.
So even if I had cash to buy a house, I couldn't buy it or occupy it.
So you could, if you had cash to buy a house, right? You could buy the house, not do any testing, right? If the lender is not pushing it, right? And you could buy the house, and then, as we had recently in North Smithville, Rhode Island, somebody could discover that they have high levels of trichloroethylene, right? And now you own a piece of property with high levels of trichloroethylene,
right?
And you're responsible for that,
right? Well, and you mentioned it too. Most loan programs require sampling these days to some degree, and I know there's a county in New York that requires sampling at sale property transfer, and you are required to add treatment if it doesn't meet the MCLs. But in general, in 99% of the country, like in New Jersey, the way they run their program is the buyer and the seller have to decide who's going to pay for the samples. The results go to the buyer and the seller only, and it's up to them to do with those as they will. It's not public information. So to answer that question, it just depends on the situation, but there aren't technically MCLs for private wells. It's just we use those surrogates in a lot of places.
Right. In Rhode Island, we have adopted the EPA's MCLs for public water systems for private wells.
Right.
You can argue for or against it. That's the way the rules were written, which I think is pretty aggressive.
It is. Okay.
It doesn't take into effect the population factor, right? You have a population of one family, so the risks in a public water system would be over, risks per million people, and this is sort of risks per one person. So there's some statistical arguments that are made back and forth about that.
Okay. Right. Someone asked if the regulations or requirements from this webinar apply to labs that test at no charge as a public service. This is an informational webinar, and there are no requirements, as you probably figured out being on the call today. And our goal really was to get some of the well owner issues out in front of all the labs so that it'll help you understand your client, what questions they might have, and ways that you might be able to help them or inform them. Our goal, I would say, to running this program through EPA is to raise the awareness that private well owners have about what their responsibilities are as a well owner. So, we all share the goal of public health protection and source water protection, and so that's really where this is at. And so, does anyone have a comment about labs that test at no charge as a public service?
So our laboratory used to test at no charge as a public service, and it became very expensive and burdensome on our facility, and so they instituted charges. My personal experience about free testing is that people value what they, and having even a nominal charge for the testing gets them to pay attention to it. I think that's all I'll say about that.
How many well owners actually drink their water? This is a really great question, and wish we had a good answer for. We were asked this, and anecdotally we know some well owners don't use their well water for anything but showers and toilets and things like that. A few years ago, I was asked by the New York Attorney General's office about the number of people that use treatment, and so we really have no data like that. But I went to Dan, who manages our public service lab and spoke earlier, and he looked through, 3 or 4 years of data where we do collect that information for the people that have their wells analyzed here, and he found that nearly 15% had RO units, reverse osmosis units, on their wells. I was really shocked by that. I think most of us would be. I think that's really high as far as the general population, and I think what we're seeing is people who are more aggressive and more interested in their water quality are more likely to have treatment, and I think that's what we see. And I think in general it's, there's 2/3 of the well owners have never even tested their well, and so I imagine most of those do not have like an RO unit on it. That doesn't answer your question, but it tells you where we're at. I don't know that anyone really has that information. Anything you guys have in New Hampshire or Rhode Island?
Yeah, well, as I showed us, this is Paul from New Hampshire, and I showed that slide that indicated that about 15% of the population in New Hampshire anyway, they say that their main drinking water source at home is bottled water. And it seems that roughly, 15% of folks with private wells use bottled water, and the same is true of also folks who are in public water systems using bottled water.
Wow.
Yeah. That surprised me too in that nitrate study going around, the number of people who weren't concerned about drinking their water or giving it to their children because they were drinking bottled water. I think if I were to look at this more carefully, we might see some age stratification. It seemed like the older members of the neighborhood, maybe that was a 1961 neighborhood, that the founders of that neighborhood, the ones that had been there for 50 years, were all drinking the well water, but the next generation was drinking bottled water. If I were to take a careful look at that.
Paul, again, interesting question, though, about the number of private well users with treatment. In that CDC project that I mentioned, there was a survey, and one of the things that the survey tried to get at was people's use of treatment. And there was a significant, over 10% of the folks who were treating seemed to be using the wrong kind of treatment for the type of parameters that they have. So, for example, they might have arsenic and they had a softener, which doesn't remove arsenic, and so they thought that they were treating their water for arsenic, but they weren't.
Well, and it really depends. Now, in that case, we looked at about 4 years of samples from the public service lab, and we found on average people with a softener were removing 42% of their arsenic, whether it was meant to or not. And it's not, it's certainly not certified for those things, but it still was, and I think that's just a factor of the type of groundwater we have here and what's being removed and changed out. Interesting, yeah. Yeah, we were shocked. All right, thank you. So what's the best strategy for getting funding to start a county-level water testing program? And I realize this probably isn't from a lab per se, but I wanted to mention that the private well class program that we do with RCAP, we've developed a workshop for sanitarians on doing effective outreach, and it's really geared for county sanitarians who might want to start a program. We also had funding from CDC a few years ago, and we did a survey of about 100 programs around the country that are doing some kind of private well program. And one thing I'll mention is many partners is the key. They share costs, effort, provide buy-in, help spread the word. There are funding programs in some states. I know Iowa has a grants to counties program. There's several others out there. And I know CDC certainly funds a few programs at the county level where there might be issues. The one I'm thinking of is there's a high arsenic county in Iowa that's had CDC funding for the last 4 or 5 years to look at their issues there. We can certainly look into that further with you if you want to contact us. We don't have dates for any of those webinars yet, but we're putting a program together that there'll be 24 live workshops around in 24 states, one in each state, and then we'll do a couple webinars with that material as well. So kind of stay tuned to the private well class for that. Availability of data on private well water quality. Well, you just saw some from Rhode Island, which was interesting. They put all their data right out there. There's a few states that do that, but it really depends on your jurisdiction and what their privacy rules are. I wasn't aware of some of the things that are out there that we learned today, But my take on this as a groundwater hydrologist is what you really should be asking about are known aquifer water quality issues. If there's a certain contaminant in an aquifer in an area, if it's a man-made thing like MTBE, it's probably very local, not that it doesn't need to be addressed, but the bigger issues like radon and arsenic and some of those things are all naturally occurring. And again, Peter showed a few maps that they have and some other examples that I pulled up. So in Wisconsin, Stevens Point has this program. They're working with their DNR, and you can look at the data. I pulled up arsenic by county, and it just shows you where some of the issues may be. You can look by township or by section, which is down to the square mile, and get a better idea of near where you live. For instance, there might be some issue. Washington State has a GIS application where you can look at water quality and information about wells, and I showed all the points here. So you just have to be inquisitive, I guess, again. And some states, Illinois does not have anything like this. We hope to someday. Again, we do have privacy issues, though. We'd be more likely to do what Wisconsin does and show it at a larger scale. Anything else you guys want to add to that? Let me go back here.
This is Paul from New Hampshire, and USGS here created a model that shows the probability of having high arsenic at any given location throughout the state, and it's based mostly on geologic factors. It turns out land use factors don't have a lot of don't come into play very, very strongly. The comment that I wanted to make is how you use that information about the likelihood of having an exceedance for any particular contaminant in an area, and using that as the basis for whether or not to test. I mean, if there's a 10% chance you have high arsenic, you should test, right? If you have a 2% chance, do you recommend people test? People, I think, generally want a simple answer. They want to know, what's your recommendation as far as testing? And so we just have the same testing recommendation statewide. I'm really worried about folks using information about probabilities of exceedances and using that instead of testing. So anyway, just wanted to make that comment.
Oh, I totally agree. It's just like, with all the lead issues. If it was even a concern, one sample won't necessarily tell you. It can vary how long it's been sitting in the pipes, all those things. And if you're really concerned, for the same cost of doing several tests or a bunch of tests, you can add a filter on your sink and be sure you're not drinking water with high lead. So you should do what's the most practical application to protect your health, so to speak.
I agree, and even on our nitrate model, we've been very cautious about broadcasting that. We use that more for targeting our outreach than for saying everybody should test something different.
Great. Should private wells be chlorinated? Well, you should only disinfect a well when it needs it. And so it's amazing. I bet I could find 100 emails from people saying, should I be putting bleach down my well? Because, my driller said, just throw some bleach down it every spring and you'll be fine. One, bleach is too concentrated by itself. You're supposed to mix it to a certain percentage. There are proper disinfection rules or guidelines to follow. I've looked at, when we were setting up this class, we knew it was nationwide. I probably looked at 50 sets of instructions on how to disinfect a well, and what I settled on is, one of the more comprehensive and understandable and useful was Minnesota Department of Health has a really good disinfection guide. It tells you how to mix it in a 5-gallon bucket or whatever, based on the size and depth of your well, so it's at the right concentration. And so under our class resources on the private well class, under lesson 10, you can find that document, a link to it. But you should only sample when you need to, and that's when sampling indicates that there are bacteria. And the other side of that is if you keep getting bacteria hits, once you've disinfected, a well owner should resample to be sure that it took, so to speak. And if you keep having a recurring problem, then likely there's a source, and you're never going to stop it from doing, quote, shock chlorination. And so there you need to consider a permanent solution, either, continuous chlorination or UV, or something like they would do on a spring instead of a well, or maybe have the well repaired. There's maybe a breach at the surface This just happened to one of the folks at RCAP is working with a well owner, and there's no rhyme or reason. They sent me a picture, and there's a giant tree within about 6 inches of the well casing, and it's a PVC well. I guarantee you the roots have cracked that casing, and that's why they're getting continual bacteria problems. So, you just want to tell people to be smart, and if it's a recurring problem, then they need to add continuous treatment, I guess is where that goes. So a few questions that we didn't answer or I didn't answer, and I was hoping that maybe some other folks who are helping us today might have a good answer to this. I know, so what situations or conditions would require a well to be shut down or sealed? The only state where I really know that there's an active program like that I've heard anything about was in Florida. I know they've got some really heavily contaminated locations, and when they find usually man-made contamination, when they find that, they sample the private wells in the area, and a lot of times they end up running city water to those locations and putting people on municipal water. And so I don't know if any of you have had any experience with this, but rarely, well owners are on their own. The county health departments, like in Illinois, can't tell you can't drink your water no matter what's in it. They're there to give advice and try to protect your public health. But if you choose to drink something that's bad for you, that's your choice as a well owner, is my understanding.
Right. So in Rhode Island, we have our interpretations of the water quality are regulated, and we have a bright red line at 10 times the MCL of a health-related contaminant, where the recommendation is do not use the well for any purposes, discontinue use for any purposes, and that's kind of our shutdown line. But we can only state that to them. We say discontinue use for any purposes, and that basically has the building official pull the CO, the certificate of occupancy, and that would generate the necessity of either identifying another potable source or condemning the house.
So that allows you to condemn that home if they don't do something to rectify it.
Correct. That allows, to be clear, that allows the local building official to condemn that home, right? If they don't do something about that. Correct.
And you're probably the only state like that. To be honest, I don't know.
I'll let you know when it happens the first time. It hasn't happened yet.
No, certainly it'll be interesting to see. Yeah. So, all right. Thank you, Peter. So, what is a certified lab? They are more expensive. So, what are the pros and cons that I can tell well owners? What about university research labs? And I know Dan or I can get to the last part, but if one of you guys want to, or Sarah, want to talk about the difference, I mean, somebody speak up.
Sure, this is Sarah. So a certified lab is one that has been reviewed or inspected by the state or a state-approved certification body. It determines how well a lab complies or follows the laws and regulations.
Great. So so like when you were bringing up the New Hampshire accreditation program, that is the state body that certifies labs in New Hampshire, correct?
Right, and this is Paul, and right, it's the Environmental Lab Accreditation Program. The states that have the programs under the Safe Drinking Water Act have to have a lab accreditation program to ensure that the public water systems are using labs that are producing reliable results. And so, as Sarah mentioned, there are on-site visits, and they also have to periodically do proficiency testing and show that they're producing results that are accurate, and they have to have quality assurance programs in place and use the right methods and so forth.
So basically, a public water supply has to use an accredited or a certified lab.
Correct.
Right.
Yes. Yeah, and this is Sarah again. So if you want to check that your lab is certified, you can contact the state and request a review of their previous reviews and inspections to make sure that they've passed everything and to see exactly what that certification includes.
From our perspective, it's a legally defensible sample, and a legally defensible result from a certified laboratory. And when it comes to expense, we always say, you get what you pay for. In our particular case, there are many many treatment companies out there that offer free testing, and invariably that comes with a back-ended pitch for expensive treatment. Our state certified labs are not allowed to have an interest in selling treatment. They can't have a financial interest or a vested interest in selling treatment.
Great. And on the university research lab side, this has come up several times. Several groups that do outreach and education are at universities. Virginia Tech, Texas A&M, and here at the University of Illinois, our program and through our public service lab. And Dan can speak to this, but our public service lab is no longer accredited. It used to be, just because of reporting requirements and some of the other things, which 15 years ago this happened, we weren't able to do the. It wasn't going to be. We weren't going to be able to pay for it all, and so it was either continue to do our work that we do and not be accredited, or just not have a lab. And so I believe we follow all the EPA methods and do all of the quality control that are required to be a certified lab. We just aren't. And I've talked to both Virginia Tech and Texas A&M about this, and they're in the same boat. And so, and like the Texas program, that's very similar to Rhode Island's, where they do workshops and collect samples for well owners. They use their university lab as well, and they consider that an accurate sample, if nothing else. Dan, do you want to add anything?
That's a good answer, Steve. We were certified. I don't want to pretend that certification is minimal. It is a big job to be certified, so I commend the labs that are certified. Yeah, Steve was right. It came down to a cost thing for us, and I guess we could continue the program without being certified, so we chose to do it that way. And we do follow quality control. I know there's, that's also very, can be very cumbersome. So we follow, in my opinion, a very good set of quality control. We have a good protocol there, and we have good SOPs, and we go through external references. But I do recognize it does take a lot of work to be certified too. So our results are not, I wouldn't consider them legally defensible, but very usable though for most people's questions. And if we do say if a legal issue were to come up, we do direct them off to a private lab.
That is certified, right? All right. Thanks, Dan. Thoughts on using commercial test kits? I'll just say one thing, and we've tested a lot of these when we tried to do studies like on arsenic with private well owners. And from my experience, I'm sure they're better than they were 15 years ago when I was doing a lot of this work, but they're good for kind of an initial view of the area, if you will, but I don't know that I would rely on one for a result. And that's just, my non-lab opinion.
Sarah, I agree. And yeah, they're good for curiosity and getting information quickly, but if you do want to make sure that the data that you're getting and then the steps that you're taking are going to be ensured, then using a certified lab is likely the best option.
We refer to them as screening opportunities.
Yes.
But one of the women who I worked with says they're like a home pregnancy test. If you get a positive result, what do you do with it? You still have to go take it to you still go to the doctor. So.
Yeah, this is Dan. This question comes up sometimes when we have customers that want to try some treatment and they want to try to save some money instead of having the water tested over and over, or also they don't want to wait for the length of time it takes to get testing. And basically, it's the same as everybody else is saying. It can be a risky thing with the false positive or false negative. We kind of explain to them the risks.
I would want to comment that there are some, it depends what you're calling commercial test kits. We've picked up in some big box retail stores locally free test kits that are provided by big box hardware stores. And if you open up the kit, you get a 5 milliliter clear vial, and what effectively is a lead generation card that says, do you own your own home? What's your income? Does the water taste funny, look funny, et cetera? And we've traced back where those business reply mails go, and in at least one case, it goes to a basement waterproofing company that sells treatment. So
Wow.
you have to be really, really careful about what they're doing. So again, with free, you get what you pay for.
Do labs generally ask for information on sample point, purge volume, or filtration? So, point of where you collected the sample. I'm not sure the point. Yeah, go ahead, Dan.
Yeah, well, I was going to say we do for all those types of things, just because if it's filtered or not, or if it's purged or not, it can affect the water quality. So we ask that ahead of time. We tell them we give them a set of instructions about collecting the sample correctly.
Yeah, I guess we forgot to mention, or maybe you did and I missed it, but one of the things that's really nice about our lab as a researcher is that when they call Dan and ask to get a sample or a kit, he asks if they have any treatment, and if they do, then usually he sends them 2 sets of bottles, and we collect one that's prior to treatment, which would be more like raw groundwater, and then one that's after, which would be more their drinking water. But it helps us understand the groundwater quality as well as their drinking water quality and how different those can be. So they're certainly good things to know. Yeah.
Thanks, Steve. That's a good point. I did not make that, and it has helped, especially sometimes when we talk about arsenic treatment. And there was a discussion about softeners before, and generally they're not supposed to take out the arsenic. Often, I think people see a co-precipitate with iron or something, but we have had people will oxidize their sample, put an oxidizing filter, and see a much better recovery. So having some treatment, some tests on their treated water before and after changing treatment has been kind of helpful, and it gives us some insight about what's been working.
Certainly. Okay. I think these are the last two. Should you always register a count when providing total coliform or E. coli results? I have no opinion on this, other than it seems to me that if you have, it's either positive or negative from my experience, so, and that's bad.
I agree. We see a lot of plate count things out there, and I tell people that bacteria are biology, which means if you have 2 today, you're going to have 2 million tomorrow.
Very true. Right. So it's really not a matter of what count it is when you take the sample. It's a matter of if it's there, it's there. So its presence, absence is really what matters. Yeah. So I wasn't sure on this question either. How do we help a well owner understand what bacteria they might have and which are harmful? And, I know we run across methane-reducing bacteria or methanogenic bacteria and iron-reducing bacteria and different kinds of natural bacteria that are kind of ubiquitous in groundwater that aren't harmful versus, E. coli and some other things. But I don't know enough about the way those analyses are done to understand when a lab is going to encounter those things and not be able to differentiate between what might be coliform and E. coli. So I don't know if anybody has any insight there. I certainly don't.
If no one else wants to chime in on that, it is possible to speciate the bacteria that you have. It's just a question of cost. Generally speaking, we do the coliform test because it's cheap, not necessarily because it indicates that total coliforms are not disease-causing in and of themselves, but it's an inexpensive way to assess general well sanitation and structural integrity. The E. coli certainly causes GI distress, but we're using bacteria as a test more for sanitation, for general sanitation and structural integrity. That other more potentially harmful organisms could enter the well, and that it should trigger an inspect and disinfect alert.
All right, Sarah, you have something to add?
Yeah, just that it's indicative of whether or not there are bacteria that could be representative of enteric-causing diseases, and so I think just having, in the majority of E. coli are safe as well, except for E. coli H157, I forget exactly what that goes, and then maybe a few others. But for the most part, these are just indicator bacteria of things that might be in people's intestines and guts and are pathogens.
All right. Oh boy, I forgot this was in here. I'm going to go through this really quick because we're going to get to the other questions. So we run this class, the private well class. That's the URL. It's 10 lessons that are meant to help well owners understand their responsibilities as a well owner. We've done a lot of extra work. We've got videos, podcasts. We do these webinars monthly. You can get on our website and check all that out. It really runs the gamut from here's how water flows through the ground, the hydrologic cycle, all the way to here are the types of treatment, here's the way contamination might get into your well. This is the front page. If you click on Learn by Email, it'll take you to a place to sign up for the class. They're sent to you once a week for 10 weeks. It's all free. I mentioned we record every webinar. We did this one in February for environmental health professionals, and this webinar today will also be up on our website. We've also created a bunch of short videos that are meant to help a well owner just describe basic concepts. What do I do after a flood? How does my well system work? Things like that. There's looks like 16 of those up now. There'll eventually be about 30 or 35. And we have a partner resources page, which we're reaching out to labs as part of our program. You can sign up here. There's a newsletter that goes out once a month. And just like we've worked with NHDES, the National Environmental Health Association, now our class is on their website that you can take and get continuing education credit for it. So the program is pretty robust. We've got RCAP folks doing things on the ground around the country, assessments of wells, and doing workshops. And I can tell you more about that later. We're short on time. So we won't take our 2-minute break. I'm just going to slide over, hopefully, the questions we have and pull that up real quick. And let me get to the top. Is there a database of well testing results which can be accessed to help determine what potential hazards may be present in an area? I think we've answered that question, but again, your state health department or agency that looks at water quality or public health should be able to give you that information. If you, whatever they may have, like I know the GIS application that Peter showed today would be one good example of that. I know we answered this question. Is an accrediting body yet? So yeah, we've answered that. Does NH have separate criteria for accrediting? Require both? I think the answer to that would be no. Correct, Paul? I mean, their accreditation is for the Safe Drinking Water Act.
That's right. No, we don't have. We're using the TNI standards, which is what just about everybody uses, I believe. So we don't have separate state standards. It's national TNI standards.
All right. And so here's a tricky question because does VT stand for Vermont or Virginia Tech? I'm going to assume it means Virginia Tech since we've talked about that issue. I
was thinking they're confusing Vermont with New Hampshire because we're right next to each other, and Vermont has Bernie Sanders and the Green Mountains, and we have the first in the nation primary in the White Mountains.
Well, but it asks if the Illinois program, which I'm assuming is Dan's, uses EPA recommended levels when evaluating water quality, and I guess the answer to that, at least for us, Dan, correct me if I'm wrong, is yes. And so if Virginia Tech, if that's what they mean, we'd have to ask them, but I believe that's true. So, and if you're talking about Vermont, yeah, and you meant New Hampshire, I think, Paul, you've done a good job of explaining how your program works, and everything does follow the EPA guidelines through the Safe Drinking Water Act. So what is a licensed interpreter?
Right. So I took a second to answer that.
So that's your answer. Oh, I'm sorry.
That's my answer there. Yep. Sorry.
Okay. So
I guess I can just answer that quickly.
No, thank you. Yeah, so the answer's here, and there's a URL here. If you want to email us, we can mail this if you don't get it written down right now. And yeah, that threw me off. Thank you, though. So for Peter, can you tell us more about private well workshops? What's the agenda? How long they last? And you've done that too. I'm going to put this on the same page. Sorry, Katie. There we go. So
we covered groundwater, well construction, maintenance, testing and kit distribution, treatment. They're about 90 minutes long. We include a Q&A with individual contact about treatment. It's couples, many of them, and it's the best cheap date in town.
Thank you. And can you comment on the importance of using a certified lab? Is it worth paying for? I think Peter's answered that. And, you know, I think it depends. You can certainly investigate. I know I have no qualms telling well owners every day in Illinois that if they're really looking for mineral analysis and metals and inorganics, that our lab, you know, does a good job, and it gives us a chance to look at the water quality in the area. But we also, you know, understand that we don't do bacteria sampling or some of the other things Dan mentioned. And so we certainly, and Dan and I have had this discussion, what are we going to tell people for our class, since we don't have a certified lab, and we've agreed that, you know, in general what we would recommend to everyone is that they should use a certified lab. It is worth paying for, just like everything else that we've talked about. So are there any states which do not implement the Safe Drinking Water Act on their own? There's only one, and that's Wyoming. And Region 9 EPA is a primacy agency for Wyoming. Every other state has its own primacy agency. In Illinois, that's the IEPA. Otherwise, yeah, they're all state-ran. And
then Arizona is the only state where the primacy does not rest with the state public health laboratory.
Okay. Well, and as far as the Safe Drinking Water Act goes, my understanding of the rules is that every state has to enact rules that are at least as stringent as the federal rule. And a state is allowed on their own, if they choose to, implement a stricter rule. So I believe in California, for instance, even though the national standard is 10 ppb for arsenic, in California they've set their standard at 5. So in Arizona, where does primacy lie? Isn't it with DEQ?
It's actually with Test America.
Okay, you're talking about now the Department of Environment in Arizona. The DEQ is who runs their certification program and all those other things related to operator certification and testing and all that stuff. And so the part of this you're talking about is the compliance sampling?
Well, the primacy lab, I mean, so that's technically Test America that does all the primacy testing.
So, well, in many states, though, you're allowed to use a private lab to do your samples if they're certified by the state. So I think we're talking about...
Yes, that's true. But the public health laboratory does not, the drinking water program does not lie in the state public health laboratory. The testing, it lies with Test America, the private lab, and so that's uncommon compared to all the other states.
Okay. All right. Oh. It's still with I'm pretty sure the primacy agency in Arizona for implementation of the Safe Drinking Water Act is the Arizona Department of Environmental Quality. I subscribe to their newsletter. I get emails.
That's true. That's true.
So it's that their public health lab isn't on. We've got something a little askew. I'm not sure what it is, but it is and they're still accountable to the state, to the US EPA, to meet all the drinking water standards. So,
Steve, I can answer this question.
All right, go ahead, Jennifer. That'd be great.
Just to provide a little clarity. So, I mean, Sarah's correct here. Arizona is very unique in that where other states, the public water systems are often responsible for taking those samples to a lab, or in some cases the states work with small communities to test for them. Arizona actually tests for all of their communities, regardless of size, themselves, using that private contractor that Sarah mentioned. So it's a very unique setup, whereas the state has contracted out to do all the testing for all the public water systems, and it doesn't happen anywhere else.
But in terms of enforcement action, it comes from the Department of Environmental Quality.
Right.
When I think of a primacy agency, I think of enforcement, who's writing the ticket.
Right. So, yeah. And Sarah's come from the public health lab side of things, and so I got where that came from. Yeah. So that's interesting, actually. So I'm sure, do the states have to pay a fee for that, Jennifer, or anything? Or the cities, communities?
I'm not sure. I don't remember.
Huh. because that's also very different. Matter of fact, many larger communities have their own labs and have become certified on their own and do their own testing, I believe. So, all right. Well, I think that's we went very long. I appreciate well over half of you have stayed even for the 2 hours, and so I want to thank everybody who participated. Sarah, this has been a great time, honestly, and I appreciate all the work that you put into this. Paul and Peter and Dan, really appreciate your insight and how your programs are going. Again, Katie and Jennifer, thanks for setting everything up and making us all look good. And this will all be online in probably a week. If you know other folks who might be interested, shoot them a link to our website. And if there are any follow-up questions, you can email us at info@privatewellclass.org, and we'll try to get that to the right person. So thank you, and all right, take care.
Thank you,
Thank you, everybody.